Tennessee has the fourth highest infant mortality rate in the United States. The U.S. leads the world in healthcare spending, but ranks 28th among developed countries in infant mortality. If Tennessee were a country, it would rank 61 in the world, behind Lithuania, Cuba, and Croatia. What will the future hold for Tennessee's children?
Major funding for NPT Reports Children's Health Crisis is provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, getting children well on their way, Vanderbilt University's School of Medicine, Department of Pediatrics. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.
Hello, I'm Kimberly Williams Paisley. Tennessee's infant mortality rates say more about us than simply how many babies will live or die within their first year. They shed light on the tremendous health disparities between rich and poor, black and white. When you look past the numbers, you find families that are devastated by the loss of a child, children who struggle to keep up with their peers in school, and a healthcare system overwhelmed by the needs of the community. Why are infant mortality rates so high in Tennessee? What do the rates tell us about the general health of our community? And what can we do to ensure all babies are born healthy? Join me as we explore the answers to these questions on this edition of NPT Reports Children's Health Crisis.
Only 23 weeks into their pregnancy, Jay and Tiffany Adams gave birth to twin daughters.
In order to resuscitate babies, or for babies to be viable, they say you have to be at 24 weeks. And I keep thinking, you know, my babies were healthy inside of me. Isn't there something that you can do? We delivered our first daughter. She lived for about 30 or 40 minutes, and we were able to hold her and, of course, name her and, you know, just look at her and be with her. But we basically got to hold each child until.
I can definitely say, you know, it's the toughest thing I can imagine happening to anybody. We've just been trying to deal with it, you know, one day at a time. It's just you go through a lot of different emotions as far as, you know, hurt, mad, sad.
There were days, and there are still days, that I don't even want to step out of the house and see other people. I guess I just didn't feel like people would really understand.
For families that lose an infant, like Jay and Tiffany Adams, Pamela Taylor is often the first person with whom they share their story. She is the official interviewer for Nashville's Fetal Infant Mortality Review, or FEMR program. FEMR teams across the state are trying to understand why more than 700 babies die in Tennessee each year.
Hey, this is Pamela. Sometimes people say, well, how do you do what you do? You know, going out and talking to moms that have lost their babies. Each time I go out, the story is very different. I listen to their stories, and then I come back and I record what they've said, never using any identifying information, so we can try to improve upon what's happening in Nashville.
When you look at the problem of infant mortality, again, this is not a straightforward problem that there's one single solution for. And so what the people who are experts in this have done is to look at, why do our babies die in Nashville? And part of that involves looking at when they're born, so how early are they born, and how much they weigh when they're born. And what we know is that in Nashville, much like in the rest of Tennessee, the major problem is that babies are born too early and that babies are born too small.
The three leading causes of infant mortality in the U.S. are birth defects, prematurity and low birth weight, and sudden infant death syndrome. In Tennessee, low birth weight and prematurity have surpassed congenital birth defects as the leading cause of infant mortality in the last 10 years.
The outcomes of pregnancy begin well before conception, and the general health of our young women in this country is not good. So young teenage girls, women in their childbearing ages, if they are not healthy when they conceive, it's hard to imagine how they're going to have healthy children.
Compared to most states, Tennessee has higher rates of smoking, substance abuse, obesity, and chronic illnesses, including hypertension and diabetes, all of which increase the likelihood a mother will deliver a low-weight or preterm baby.
For at least 20 years, I've been able to see obstetrics evolve. We've seen more young girls being pregnant 15, older women being pregnant 45. In the last 10 years, obesity has become a major problem, even in young women of childbearing age. Obese women are more likely to have chronic illnesses, diabetes, high blood pressure. Obese women increase their risk of having a stillbirth by about 2 times over that of the general population. One of our offices is in a more suburban area. And I thought, well, okay, it's a more suburban area, college town. Most of these patients would be of normal weight. No. So obesity is actually affecting across all socioeconomic lines and in all areas.
The increasing number of premature and low birth weight babies born in Tennessee rely on highly advanced neonatal intensive care units, or NICUs, for survival. Some of the medical interventions that exist today were developed through the work of Dr. Mildred Stallman. In 1962, she created the first NICU in North America at Vanderbilt University.
When I first started, we sat and watched babies die. We had no approach toward babies with respiratory problems. We had no ventilators. We had no way to do blood gases. We couldn't monitor them. We couldn't even keep them warm in an environment on a continuous basis. We just didn't have any methods to manage acutely ill, critically ill babies. And so we sat there and watched them breathe hard and die.
Under Dr. Stallman's supervision, the first babies were artificially ventilated. Vanderbilt researchers shared their results with hospitals around the world and in turn learned from the work of others.
Once we got to where we could feed them adequately and ventilate them adequately, then things really began to make an enormous difference.
Many more premature babies are surviving today, but there is a cost. The earlier and smaller babies are when born, the more long-term complications they face.
We've gotten to a place where if we were having this conversation even 10 years ago, some of those smallest babies and those babies who come so early would never have survived. But many of the children will still have significant problems that they'll live with for their whole life.
And those last few weeks of pregnancy are critical. So for example, the fetal brain nearly doubles in size in the last 6 weeks of pregnancy. If you look at the brain of a 34 or 35 weeker, it's significantly smaller than the brain of a baby born at 40 weeks. And we know that preterm babies, even slightly preterm babies, have more learning difficulties, more problems in school. Some of it most likely has to do with that brain growth that is supposed to take place in those last weeks of pregnancy that might be altered by exposure to an environment it wasn't quite ready for.
Please welcome the Turner family.
Ashley and Jimmy Turner, an ambassador family for the March of Dimes prematurity campaign, share experiences from their stay in the NICU with others. What they saw through their daughter Ellie, born at 27 weeks, changed their lives.
As much as the NICU tries to recreate, the womb, it doesn't always work, and the babies don't always mature and grow the way that they need to. A lot of babies, they go home with a breathing machine because they don't really overcome the apnea like they should, or their lungs are, just not quite strong enough, or, they have digestive issues, or they can already tell they're going to have a vision impairment or, a hearing impairment.
3, 4,
Keisha Bass is familiar with the lasting effects of preterm birth. Her son Donovan was born at 23 weeks gestation.
He had a total of like 6 or 7 surgeries during the time he was in the hospital. Once he got out of the hospital, he had at least 4 to 5 doctor's appointments a week. Donovan is now 4. He has a speech delay, but now he's speaking a whole lot better than he did before. He has a speech therapist. He had a physical therapist because his balance was kind of off. He was kind of delayed on the potty training, and he didn't walk until he was like maybe 2, 2.5. So he progresses, but it's just kind of delayed.
Good dog. When you think 241 babies a week in Tennessee are born prematurely, that's 11 kindergarten classrooms. It's a lot of kids that are facing challenges that if they had been born full term they wouldn't be facing.
Despite the more than $26 billion spent each year on preterm babies, the U.S. standing in international infant mortality rankings continues to worsen.
We've got top-tier hospitals, phenomenal medical teams to take care of patients, and yet we've got some of the worst infant mortality rates in the country. We have infant mortality rates in this city that are worse than some developing countries. So why is that? We've got access to all these facilities, we've got access to all these experts who ought to be able to fix these problems. And so what you realize is maybe it's not the health care. Maybe it's the fact that our communities are unhealthy from the broader perspective, and those things contribute to these problems.
God bless you. And just want you to know your church and the community is thinking about you and wanting to remember the life that you brought into this world.
In North Nashville, Pastor Brooks and his church are celebrating Mother's Day. Their service begins recognizing mothers in their congregation who have lost an infant.
93.5% of North Nashville is black. So that means these babies that are dying in North Nashville are black.
When we look at our infant mortality data, there are several ways you can look at it. When we look at it based on our gestational age and our birth weights, it gives us one picture, which again tells us that prematurity is a major issue. But when we then take that information and map it across Davidson County, it tells us another story, and that really is a story of inequity and disproportionate loss in certain areas. Unfortunately, those areas tend to be areas that are higher in poverty, higher in foreclosure, higher in unemployment, higher in fast food establishments and no grocery stores, higher in crime, and unfortunately higher in black and brown people.
It's a national disgrace that a black baby born today is still more than twice as likely to die within the first year of life, and that we still have not been able to close the gap for the last 50 years. The experience of racism increases the release of stress hormones from the mother, and during pregnancy, in a couple different ways, these stress hormones could cross the placenta and in a way bathe the baby, and not only could these stress hormones precipitate preterm labor, they could actually affect the way the baby's brain develops.
In Tennessee and across the U.S., certain populations are at higher risk for infant mortality and poor birth outcomes.
Certainly as a state, we have a high infant mortality rate. But if you could go within the county and dive down into the specific zip codes, what you might find is that there's one zip code that is really driving the numbers.
In Tennessee's urban centers, risk factors can cluster together, making it difficult to lead a healthy lifestyle, not just for individuals, but for neighborhoods, communities, and cities.
In a place such as Memphis, where we have such huge disparities in terms of socioeconomic status, disparities in education, disparities in poverty, racial disparities just in terms of our demographics, what one sees then is the perfect storm. We see all of those factors converging to create disproportionately high infant mortality rates.
Infant mortality rates in Memphis are among the highest in the nation. A quarter of the infant deaths in Tennessee occur in Shelby County alone.
We are clearer today that infant mortality is used as an index, as a reflection of the health of the public. It's the end effect of all of those other components that are leading moms to be unhealthy. Infant mortality is a social issue. It is an issue which reflects the social determinants of health. We are clear about that now.
I subscribe to the broader view of what is a health problem. Unemployment, chronic unemployment is a health problem. You can't feed yourself. That's a health problem. Mother's lifestyle, father's lifestyle, employment situation, where are they living, all of those things. That's what it's going to take.
Hello. Hey, how you doing? If these babies are born into homes where they're ill prepared to take care of them, it's a curse that continues to progress. It's a problem that continues to get bigger and bigger, and it just spirals out of control as the child gets older.
In Tennessee's most rural communities, resources are harder to find. High obesity rates, smoking, and prescription drug abuse result in increasing numbers of low birth weight babies.
We need to address some of the staggering drug abuse issues that are going on in our communities. And again, it's not just our community, it's nationwide. But the problem is in this rural community, it's really hard to get moms off of drugs during pregnancy. It requires social workers, it requires people who are trained. It requires families having the ability to travel to these places. And it requires money for gas and for housing when those patients do need detox. We try really hard to see the patient more than just a physical body, not just a physical problem. We try and see what else is going on in their homes. A lot of times the reason why they are obese is because they're not eating healthy. But the reason why they're not eating healthy is because unhealthy food is less expensive than healthy foods. And the reason why they can't afford it is because there are no jobs available here. And so we're trying to address the different levels of the problem.
The causes of infant mortality are not unique to Tennessee. In Tennessee, however, a poor culture of health is driving higher infant mortality rates.
As a region, the South does not do as well in terms of health. Health is not created simply in the work being done by our healthcare providers and by our healthcare institutions, but that health is created in communities and in workplaces and in homes and in neighborhoods. And we really need to think of how can we create cultures of health in those institutional contexts that really facilitate and encourage individuals to make healthy choices.
Are you having any fears or chills or anything like that?
One thing that's important to realize that even our healthiest population in Nashville is sicker than a lot of populations in the rest of the country. The state in general tends to be pretty bad. We rank in the bottom quartile
in almost every indicator. Our infant mortality rates for our white population are still higher than the rate is in a lot of the other states.
I believe more in education than I believe in any other entity, maybe more than in medicine. If you wind up with an uneducated population, you're going to wind up with a population that makes wrong decisions.
Changing the culture of health in Tennessee starts with individual choices. Programs across the state addressing Tennessee's birth outcomes begin with educating the mother and encouraging a healthy lifestyle for her and her family.
She's being encouraged and assisted to get to her prenatal visits during pregnancy. She's being discouraged from smoking and drinking and taking drugs during pregnancy. She's being helped to understand how to eat well during pregnancy. She's being encouraged to plan for the birth and then to breastfeed her baby.
Being a parent, you get lost in your problems. You get lost in how am I going to pay my light bill, or where am I going to get that gallon of milk my daughter needs. You just get lost in life.
Sheila Smith works in rural East Tennessee's Campbell County. She begins visiting families during pregnancy and will continue visits twice a month until the child is 3 years old. Her program recognizes that a child born healthy and encouraged at an early age will have better opportunities throughout adulthood.
What is this? I know these hardships. I experienced them as a child, and I've experienced them as a mother. I spent a lot of my young years in the hospital, so I got delayed in my vocabulary and reading skills. And that's where it all starts, is from birth, from the connection.
That horsey?
Yep, that's the horsey. When I first became a home visitor, you could talk about breastfeeding to moms and then it was just like a dirty word. But through the years that I've been doing this, I have more moms starting to breastfeed. Not only the advantages of having the milk ready, it's more nutritious, it builds more immunity for your baby, brings up the IQ of a child. Can you show me a blue ball?
It's a shame that you have a baby today. There's no guarantee you're going to see that.
On any given day in Memphis, Rachel McGee is out talking to people about infant mortality rates and prematurity. Rachel trained to be a lay health advisor through the March of Dimes Community Voice program in Shelby County. But she also speaks from experience. Her son was born premature.
I've heard of people having premature babies before, but I didn't know it was that bad. When he first got in the NICU, I was like, wow, there was a lot of babies in there. Seeing all the babies, I was like, okay, I'm not alone in this. And make sure you keep yourself healthy. We want to urge you to continue on taking your prenatal vitamins.
After the pregnancy?
After the pregnancy, because
Community Voice has trained almost 800 health advisors like Rachel McGee since it began in early 2008.
I go to colleges, I go to my church, I go to community centers, I go everywhere. One time I had like a whole bus presentation. It was probably 20 people on the bus, and one lady asked a question, then a man asked a question. And next thing you know, I was standing up talking to the whole bus about infant mortality. Baby mother who's drinking, maybe she's breastfeeding and drinking, that baby is drinking that alcohol. That baby is smoking that cigarette. We can prevent this. We can help these infants to survive. And so these babies can live a normal and long life.
So much I can't keep track.
Access to prenatal care has been proven to reduce infant mortality. But some providers believe traditional prenatal care could do more to educate and compensate for the lack of social support some mothers face.
When a pregnant woman walks into my office, we need to focus on her environment, including both social as well as physical environment. And I think this is where our system currently fails us, because what typically happens in prenatal care, in that 5-10-minute office visit, we may take the blood pressure, We listen to heart tone, we check the fundal height, we answer a couple questions, and that's it.
What is your advice to our younger mothers maybe having their first baby?
You have to breastfeeding.
Centering pregnancy is a form of group prenatal care designed to broaden a mother's education during pregnancy and create a supportive community with other families as they prepare to become parents. Where traditional prenatal care visits last 15 minutes, centering sessions are each 2 hours.
Patients, when they come in, will do their own blood pressures, do their own weights, keep their own journals. After the assessment, all the patients gather in a circle in a group. So they, what we call circle up. And so then they discuss nutrition, exercise, childbirth preparation, stress reducers. Patients also talk about things that are concerning them.
So you want to make sure that we don't get to the point where we have to do CPR, right?
They receive support from the other members of the group.
According to a study by Yale University, centering programs resulted in a third fewer preterm births, increased patient knowledge, and increased breastfeeding compared to traditional prenatal care.
If we can start addressing some of the difficulties that our moms are having when they're pregnant, I think it's a good start, but it's definitely not the whole picture. There's a bigger perspective, there's a more holistic approach that we desperately have to put our minds and our actions to, but we're not there yet.
We need to move beyond trying to simply change individual behaviors to strengthening family and communities to change those conditions on the ground so that mothers and babies can be healthy.
We've studied infant mortality to death. We know it's a problem. We know the disparities. We can all quote it in our sleep. If we can make sure that our young people are healthy long before they contemplate having children, then the chances are that they're going to have a better birth outcome. It's how do we go as far upstream as possible in solving the problems by making sure that the community starts to embrace health, and the best way to change any community is to affect the youth.
When we invest in children, we have their entire lives to reap the benefit of the investment. And if we can lay a good foundation in kids for good health, we will reap that benefit over multiple decades. We can't sit back and say we don't know what to do, and we don't know what will work, and we don't know there's a problem. There is clearly a problem. We know what to do. We know that it can work. I mean, we smart people. What are we waiting for to step forward and take advantage of this moment and really make the investments that will keep America great in the future?
The health of our babies reflects the broader health of our community. If we want to improve our infant mortality rates, then we need to do something to improve our own health now, not tomorrow, not once our mothers get pregnant. A foundation of good health is one of the most valuable legacies we pass on to our children. We must act as individuals, but also as a community to create a culture of wellness that supports our children's future. Please join me in learning more about the children's health crisis in Tennessee and what you can do about it by tuning into NPT's ongoing coverage and by visiting us at wnpt.net/children's health. Thank you.
Major funding for NPT Reports, Children's Health Crisis, has been provided by the Healthways Foundation, addressing the critical issues of children's health and public education, the Nashville Healthcare Council, the Monroe Carroll Jr. Children's Hospital at Vanderbilt, getting children well on their way, Vanderbilt University's School of Medicine, Department of Pediatrics. Additional support provided by the Orrin H. Ingram Fund and by members of NPT. Thank you.